Before we get underway, before I introduce Dr. Marsden, I would just like to turn things over to Keith Berganza, who will introduce us to our preliminary speaker for tonight. Keith has been the co-chair for Prostate Cancer Support Toronto since 2015, and his own prostate cancer journey began in 2015 when he was treated with surgery, followed by radiation in 2016 and 2 years of androgen deprivation therapy. Keith, I'll turn it over to you.
Thanks, John. Good evening, everyone, and welcome to today's Awareness Night presentation. This is a special month for all of us. This is Prostate Cancer Awareness Month. And to highlight that, we have a special guest today to speak before our special speaker, Dr. Marsden. Before I introduce him, I would like to give you a little bit of background for those of you who have joined us after 2020. Till 2020, early 2020, we were all known as Prostate Cancer Support Networks, Prostate Cancer Canada networks, and we were under the auspices of Prostate Cancer Canada. Prostate Cancer Canada looked after all the support groups in the country outside the province of British Columbia. In BC, the groups were managed by the Prostate Cancer Foundation of British Columbia, and that's a long name, so I'll refer to them as the BC Foundation from now on. So in 2020, early 2020, the Canadian Cancer Society swallowed up Prostate Cancer Canada. So there was no umbrella organization to manage the groups or to help the groups that were outside BC. At that time, the BC Foundation stepped forward and said that they were going to set up a new umbrella organization called Prostate Cancer Support Canada under their auspices, and they invited groups across Canada to join them. And of course, most of the groups did, and if I'm correct, almost all have joined and are working together with great support from the BC Foundation. And today I have the distinct pleasure to present to you Peter Ferry, who is the chairman of the board at the BC Foundation. A little bit about Peter. Peter graduated with a commerce degree from UBC, University of British Columbia, and 2 law degrees from Oxford University, where he went on a Rhodes Scholarship. He also attended 2 of Queen Elizabeth's garden parties at Buckingham Palace. I'm sure those were memorable experiences for Peter. He practiced business law at national law firms like McCarthy Tétrault, as well as Gowlings for over 40 years. He's a Queen's Counsel, and he has QC after his name. And he's probably one of the last few, as there won't be any more for now that there is no Queen. He's also did legal work for charities and not-for-profit organizations. And now he's chairman of the board of the BC Foundation. He's been a board member of Prostate Cancer Foundation BC for almost 15 years and has been involved in much of the evolution of the BC Foundation, both technically, legally, and in its general direction. He's very involved in interactions with organizations like Prostate Canada in the past, and Movember, etc. Peter's exposure to prostate cancer is a little more than just through the BC Foundation. His brother was a radiation oncologist, so he knew quite a bit about cancer, but not specifically about prostate cancer. Although his dad had it in his 80s and he was treated and lived to 100, he did not learn much about it at that time. However, since joining the board, his oncologist brother was diagnosed with prostate cancer 9 years ago at age 70 and has been successfully treated for aggressive version of prostate cancer. Peter has been involved with the Canadian Diabetes Society in an advocacy role, and also the Kidney Foundation, mainly because of some serious health situations in his immediate family. He's also been involved with a number of other charities and nonprofit organizations. He's the chair of the Continuing Legal Education Society. He is the governor of the Law Foundation, and he's also on a number of scholarship committees. He's an avid sportsman. His main sport for over 50 years was ice hockey, and this included playing for Oxford University in England, where he also coached for 20 years. Peter rowed and played rugby for his college, and he played varsity cricket at the University of British Columbia and also at college level in England. He has coached baseball while his sons were growing up, and he regularly played on the Gowling's slow pitch team till as recently as last summer, where, as he says, he was the oldest member of the team by about 30 years. Peter is now 67 years young, is retired, and he lives lakeside in Peachland, where he keeps himself busy working on renovating his place. He has a boat kept under his house and is an avid water skier. He was at Whistler when it opened in the early 60s, and he's been a downhill skier ever since and frequently goes snowshoeing in the Okanagan. He also has an apartment in Kitsilano and enjoys lots of travel. With all this activity going on in his life, he still hopes to find some time to write novels. But today we are grateful that he's found the time to come and speak to us. So without any further ado, Peter Ferry, over to you.
Well, thank you, Keith. That was probably not intended to all be included to bore everybody about things I've done, but it gives some background as to how long I've been involved with prostate, and I'm delighted to be here to celebrate Prostate Awareness Month with you. I think it's really important that we all, just like you, work together to help each other. All the organizations work together and do not compete. And, you know, we don't, as a foundation, try to dictate or tell other people what to do. We want to be a facilitating body because we had all these resources. The BC Foundation started by 6 support group people about 27 years ago, and they found it more effective to work together and help others and achieve success in both awareness, support, and research as the primary things. Advocacy has never been a strong suit, but it's in there somewhere, but it's not that key. But what we're particularly keen on doing is helping groups be more effective and sharing our resources, because we had 20, 25 active support groups in BC when PCC, the Canadian organization, disappeared. And we had created a lot of resources, and particularly with COVID, a lot of online resources, and now terrific new website coming out next week with terrific resources there, because you can record, world-class speakers like you have tonight, interesting speeches, you can share data, you can share means of improving support group attendance, effectiveness, Zoom training, all the practical things that support groups need, because just like you guys working together help each other, if all the groups across Canada help each other, it's that much more effective. You gain and learn from each other. And Winston, who's part of your group, is part of our BC board, and we've learned a lot from him already. And it's just a small example of that kind of sharing that can occur in terms of knowledge. So I want to congratulate your group. We're there to support you, provide resources. There are a number of things, both for individuals we can do. We have special support groups for special interests, such as active surveillance for advanced prostate cancer, for partners. There's exercise groups which transcend any provincial boundaries. I mean, these are areas of interest. So in a group with a new diagnosed person coming in, some of those topics like advanced or something might not be as pertinent or it might be somewhat daunting, but by specializing and allowing this, we've developed these programs and look to develop more in response to your needs and to provide you resources, both physical, like we have Reef Knot kits with brochures and guides, exercise guides, nutritional guides, books by leading authors that are included in there, which are given free to newly diagnosed patients. So as you all know, it's a tricky disease. There's lots of information, but there's not a lot of practical information necessarily in order that doctors have the time to spend to provide the practical things, nor do they even understand them sometimes. They provide a terrific service to all of us, and we do not provide medical advice, and we can't do that. We have to be very careful not to do that, or lose credibility, so we're very careful. But what we do is support men and their families, and do what support groups like you do, and support you as well. And we can provide fundraising opportunities, resources, one-on-one peer counseling. We certainly put on conferences that many of you would have attended recently. And by working together, we can really do terrific things. So you've got a great group there. I wish you a great meeting, and appreciate the work that all of you do, and the sharing that goes on in this difficult task that we all face, and wish you the very best.
Thanks very much, Peter. And we must say that, it's been great working with the BC Foundation for the last couple of years, and we are excited, going forward to continue to work and, help men all over the country. So thanks once again for your time, and have a great evening. And I don't know if you're planning to stick around to listen to the presentation, but once again, thanks a lot.
Well, thank you very much, Keith, and all the rest of you. All the best.
Thanks, same to you. Over to you, John.
Thank you, Keith. Our guest speaker tonight is a true leader in the field of naturopathic or integrative medicine in Canada. And I'm not just saying that because I happen to be a patient of his. Dr. Marsden, ND, his official title, is currently the clinic director at the Marsden Center for Excellence in Integrative Medicine in Vaughan, which is a large multidisciplinary clinic and research center with a focus on integrative cancer care, environmental medicine, and allergies, and general wellness. Those of you who are familiar with naturopathic medicine know it's known mainly now as integrative medicine because it's intended to work in unison with conventional medicine. Dr. Marsden is a graduate of the Canadian College of Naturopathic Medicine in Toronto, and he's been a practicing naturopathic doctor with a special focus on integrative cancer care for 20 years. He is the course author, director, and instructor of the Ontario Association of Naturopathic Doctors certification program for intravenous infusion therapy, or IVIT, which is used for treatments like high-dose vitamin C therapy and therapies like that. He has authored 3 clinical studies and numerous other publications on the safety and efficacy of naturopathic IVIT, as well as mistletoe therapy in cancer care and integrative cancer care. Dr. Marsden is the residency director for the Marsden Center's Naturopathic Cancer Care Postgraduate Residency Program, which is certified by the Council of Naturopathic Medical Education and is affiliated with the Canadian College of Naturopathic Medicine. In addition, he is the past chair of the Principles of Care Committee for the Oncology Association of Naturopathic Physicians, which published guidelines for naturopathic cancer care in 2019. And he is also past chair of the Ontario Association of Naturopathic Doctors Government Affairs Task Force on Regulatory Transition, and was a member of the association's board for over 10 years. He has lectured internationally in the field of integrative cancer care, intravenous therapy and integrative medicine, and environmental medicine, and has been quoted as an expert many times by media organizations such as the CBC, the Toronto Star, and Reader's Digest. He is married with 2 young children, and in his spare time, he coaches basketball at the Toronto Waldorf School in Vaughan. Dr. Marsden, we're honored to have you here tonight, and thank you so much for agreeing to speak to us tonight. And without further ado, I'll turn the floor over to you.
Great. Thanks so much. I appreciate the introduction. Gosh, it sounds so long when it's read out. But you know what? Thank you so much, especially during the month of September. It's an honor to have the opportunity to speak to your group. You know, a bit of a daunting task to talk about naturopathic or integrative therapies. What I'm going to try and do is share my screen. So hopefully I've got a little bit of a presentation so you don't see just my mug for the next 45 minutes or an hour. So just a moment here. All right. Hopefully everybody can see the slide deck. Is that, anybody give me a thumbs up to make sure it all's working right? Awesome. Thanks, Phil. Great. Okay, so let's get started. This is me. You heard about me in the introduction. I won't beleaguer that. Just as a quick disclaimer, because it's important from a perspective of, I want to give you an overview of some of the therapeutic possibilities, some of the evidence behind what we do, but it's not meant to serve as, obviously, as medical advice. And it's important for you always to talk to your healthcare provider, visit a naturopathic doctor who specializes in cancer care or has a special focus in cancer care before implementing anything we talk about here. So let's go over a few things. You know, I wanted to provide information about tools we use, therapeutic approaches, strategies, and so on in the area, particularly of prostate cancer. And I figured what we'll do is talk first about what is integrative medicine, what is naturopathic medicine, and then go into a little bit of how our treatment approaches can help you throughout the journey when we're talking about prostate cancer. And then finally, hopefully we'll have a fair amount of time for questions. I tend to be ambitious with my slide decks when I present, so hopefully we'll be able to move through this without me starting to speak like a chipmunk at some point. So let's talk first about integrative medicine in cancer care. You know, many people maybe don't know about naturopathic doctors. Maybe you have been to one or you know of one. So I'll give you a little bit of a background. Naturopathic doctors are regulated in most Canadian provinces in one territory. In Ontario in particular, we have a broad scope of practice where we're able to do physical exams, laboratory tests, some limited prescribing. The training itself is 4 years, postgraduate. My undergraduate degree was in human biology and clinical biochemistry at U of T. And the education for naturopathic doctors is standardized in North America. And actually there's a broad push for it to become worldwide. It's got a long history in Europe, as well as places like Australia and even in Asia now. There is residency programs that are available. As I mentioned in the intro, we have a 2-year postgraduate residency program, and we also do fellowing. And there's fellowships through something called the FABNO, or the Fellowship of the Academy of the Board of Naturopathic Oncology. And for those of you who are interested in associations, the Oncology Association of Naturopathic Physicians is the key organization that sets sort of the standards for practice, for education, for advancement, and so on. This was a publication I was really happy to be a part of, that we put together some of those principles of cares for naturopathic doctors. We can tend to be a fairly eclectic group. So it was really good to finally be able to put together some of the principles that we want to work on. And this is important because, you know, I chuckle, I say I'm a quack, but I'm a well-educated one. And we want to make it sure that there's a consistent quality and approach to patient care across the spectrum. What I wanted to highlight is when we talk about integrative medicine, you know, really there's a whole integrated team approach. And, you know, I haven't included our conventional partners in terms of oncologists, medical oncologists, radiologists, radiation oncologists, surgeons, et cetera. But from the sort of non-conventional side of things, sure, we have naturopathic doctors, but we have people like traditional Chinese medicine and acupuncturists, nutritionists, chiropractors, massage therapists, physiotherapists, psychotherapy and psychology, and all of these play a role and have important potential in each individual's journey with prostate cancer. Now, obviously, I'm not an expert in all of these, so we're going to talk specifically about naturopathic medicine. I'll put a little bit of a dash of traditional Chinese medicine and acupuncture as well. And of course, talk about things like nutrition and so on. So naturopathic doctors are kind of interesting. We have training in almost all of these modalities. So there's an appreciation of each one of them and how they can be used in an individual care. One of the things I wanted to highlight is what is a supportive care or an integrative care approach. And it was mentioned earlier in the introduction, but integrative approaches are integrative, not alternative. A lot of times the old approach was complementary and alternative medicine. It gave this sense of either or. And I tell patients, I said, listen, it's not about dogma. Treating people with dogma never works. It's about treating people with what works. And so really we want to look at using the best research evidence that we have along with our clinical experience, as well as you as the patient's values, to determine strategies. And so there's a lot of flexibility in care. There's a lot of choice. And then of course, depending on each individual patient situation, we can use all of those different tools, all of those different professionals in the care plan. What's also very important is whenever you're using integrative therapies, it's important to look at the potential for interactions. Really, there are possibilities, sometimes overstated, but there are definitely possibilities where some non-conventional treatments can actually negatively interfere with conventional approaches, whether that's things like anti-androgen therapy or androgen deprivation therapy, whether it's radiation and so on. So it's important that you want to look to people who know what they're doing. So this is why you want to use trained people with experience, either through residency and fellowing in the field of cancer care. All right, so where can integrative or naturopathic therapies fit in? And I really look at it along this, it seems very linear, but often it's a circular pattern at different parts. But in terms of the journey, we have, primary prevention before diagnosis, supportive treatment during active cancer care using conventional therapies, recovery and restorative care after some of those treatments, and of course, secondary prevention, which can play a role in things like active surveillance and so on. So let's talk first about primary prevention. And my guess is most of the people on this are not as interested in primary prevention, just because, this is a group that is obviously geared at supporting men who've already had a diagnosis. But I just want to mention it in part because obviously if you have a diagnosis, there is genetics does play a bit of a role in hereditary or family history for prostate cancer. So for those of you with male children and so on. But things like age, ethnicity, family history, genetic changes, diet, chemical exposures, potentially even chronic inflammation or infection, particularly within the prostate, these can all play a role. And, we want, whenever possible, to look at preventing things. And so it's often helpful to see people who take a look at a broad picture of your health to manage this, particularly the chronic inflammation infections. Diet is also important. I do look at risk reduction strategy beyond just lifestyle early on, especially if there's a prevalence of 2 or more risk factors, and really doing a more aggressive approach. When I talk with patients, I look at physical activity and diet really as active treatment, almost like a prescription, because there's really solid evidence that these two things, whether we're talking about primary prevention or whether we're talking about treatment throughout the phases of the journey, can play an incredible role, both in terms of quality of life and how you feel, but also in terms of outcomes, in particular survival, and so on. So physical activity, we'll talk a little bit later about some strategies. I bring it into a slide during supportive care, but diet's really important. There are some basic principles where we have fairly good data about their use in prostate cancer. We know that generally reducing animal protein and increasing vegetables have a pretty good, strong evidence basis for both primary prevention as well as improving outcomes throughout this. You can also look at time-restricted eating. These are things like intermittent fasting for certain individuals can play an important role. The most important thing about diet is individualized. So a lot of times we think that there's one diet, patients will say, well, what's the cancer diet? And there isn't one, because there's not one patient. We all have different backgrounds, foundations. We have different things going on in our metabolism, how we manage sugars, how we manage fats. We have different things going on in our internal environment, our microbiome, or the bugs that live inside us. These can affect things like immune function and so on. So really, diet is important to be personalized. And so while there are certain key principles here in terms of the vegetable and animal protein reduction, there are many other principles that would be individualized to each person. And you need to do a detailed assessment for that. There are some chemopreventive therapies. And when I use the term chemopreventive, it's just this term that's used for substances that can prevent disease. And in particular, some of our bigger foods that we have as our diet have been in diet through, in some cases, thousands of years. Things like green tea, curcumin or turmeric, lycopene, which is part of antioxidants in certain fruits and so on, omega-3. Vitamin E is very controversial. My guess is we might get a couple of questions about this. There's been all over the map with different studies looking at vitamin E and its possible either prevention for risk of prostate cancer, or perhaps could it increase the risk, depending on the study. There was a great prospective randomized 30-year study that was just published this year that actually I think was the best one done on it, which showed particularly the natural forms of vitamin E have a preventive effect. Selenium, I do recommend is caution in terms of those substances that can be preventive. Okay, now what about care during both, post-diagnosis, during active conventional treatment, whether it's surgery, radiation, and then of course beyond. So when we're talking about what are we doing when we're supporting care, I put here symptom support, but it's really not just symptom support. Obviously we have 4 kind of goals. We want to make sure that we enhance therapy success. And depending on where you are, what your unique clinical situation is, therapy might be radiation, might be surgery, might be a combination of the two. There are also all sorts of other therapies, whether we're talking about HIFU or somebody had mentioned TULSA earlier. There's some really interesting care effects there, other ablative approaches. We want to help manage side effects. So during care, we want to make sure people feel good. And I know a lot of patients, particularly guys, I don't care how I feel during treatment as long as it works. But actually, there's good evidence to suggest that if you feel good during treatment, you do better, both in terms of your outcomes as well as obviously living life. And then last but not least is want to look at preventing common side effects of care. And we'll talk a bit about each one of those things. So,
and FanDuel was 40.
Sorry, I think somebody's got their mic on, but
That's 3, 10,
so I'll keep going. So there are some, obviously there's a variety of different conventional therapies. We talked about a few of those there, of course, hormonal or anti-hormonal therapy, along with all the other surgical or local treatments. There can be things like therapy for skeletal disease. These are things like bisphosphonates and so on. There's targeted therapies and even immunotherapy right now in certain cases. And here are some of the side effects that can be experienced both during after active treatment or after along with long-term treatment. So let's talk a little bit about fatigue. Fatigue is actually the most commonly experienced symptom during and after cancer care. And in fact, fatigue can last for months to years. It can result in all sorts of long-term negative effects, not just in terms of well-being. And there are so many things that are involved in fatigue. A lot of times, whether you've just finished surgery or you've undergone radiation treatment or you're on an anti-hormonal therapy, there's almost this assumption that you should feel tired. But there's so many different dimensions to fatigue, and you don't necessarily have to. So we have things like nutrition that need to be looked at, stress, depression and anxiety, deconditioning, hormonal changes, et cetera. These are all things that can be associated with fatigue. When we look at the best treatment for fatigue, it's really physical activity. And physical activity also has the added benefit of improving outcomes. And that doesn't matter whether you just started physical activity now. Now I have a couple people running here, the idea of physical activity, but really it's just moving. And it can be walking. It can be cycling. It can be elliptical. For us as guys, as we get older, almost more important than cardiovascular or aerobic exercise is resistance training. This is also critical if you're on a form of anti-hormonal therapy, because one of the side effects of those treatments can be affecting your lean body mass. And we actually know that you can preserve that muscle mass when you're on these treatments by using resistance training. And that doesn't mean you have to become a gym rat and lift tons of weights and so on. It's simply just body weight exercises using everything from Pilates to yoga to modified sit-ups and planks and all sorts of things, bands, etc. These can actually all help both with fatigue and maintaining lean body mass ongoing through care. One of the important things is if you were not an athlete before, or heck, even if you were, the thing to remember is you've got to be a bit careful when you're restarting, particularly after various procedures. And so it's important to modify your exertion and start back slow. We recommend this Borg scale as a simple description. I'm happy to share this if people find it interesting, the whole presentation. So you can have a copy, you don't have to take notes, but normally you want to start at 4 to 6 out of 10 in terms of an exertion level. A little bit hard, but you're walking briskly, but you could keep it going. We really don't want to have the heart rate go crazy. And from a weight perspective or resistance, you don't want to hurt yourself. So it's better to start with light and build on that. Diet, really important. I'm going to reiterate it. There are ways in which we can assess for what's the most appropriate diet for you. It's not only about balancing the different macronutrients like fat and protein and carbohydrate, but it's also understanding the quality of the food. It's understanding your metabolic situation. Is there insulin resistance? This is really important. If you have diabetes or the beginning of insulin resistance where you're not controlling your blood sugars as well as you could, that also can play a role in cancer outcomes. So it's important that we might want to look at different dietary interventions in those cases. There are other things to help during and after treatment to support energy. I want to highlight one that's on here that can be used a lot, which is American ginseng. You have to be very careful in some cases because there is some evidence to suggest it can bump testosterone. So you want to be mindful of that. But mistletoe, astragalus, ashwagandha, these are Asian herbs. Magnolia, philodendron, many of you, if you're a gardener, you know these herbs. Omega-3, even things like St. John's wort. These are all things that can help mood and energy in patients going through treatment. And all of those actually have clinical trial data supporting their use in that context. Bowel dysfunction is also something that can happen when undergoing particularly external beam radiotherapy. Very occasionally we'll see it in patients undergoing brachytherapy. It can also happen sometimes in some patients post-surgically. Sometimes there can be imbalances in the gut microbiome after surgery. There's also some cases, particularly with radiation, where long-term proctitis. We have great tools for this. Probiotics, and there are specialized ones that can be used for this. Probiotics are really interesting in that, I tell people probiotics are tourists, they're not immigrants. They don't stay in the bowel, but they can help to repopulate the terrain or change the terrain, which will allow proper repopulation with good bacteria. Simple things like charcoal, a very cheap old school remedy, can help with issues around this, demulcent herbs. And even there are certain herbal suppositories that we can use like witch hazel for proctitis alongside conventional interventions. If some patients get to the point where they're needing chemotherapy, although this is not used as much except in long-term advanced cancer and prostate cancer in particular, mistletoe has a long history. I don't know how many people have ever heard of mistletoe, but there's a long history, particularly in Europe, of over 100 years, and dozens of clinical trials showing its benefit in terms of reduced side effects of conventional care, improved quality of life, improved response, and overall survival in cancers, a variety of ones, including prostate cancer. It's really interesting. People don't realize in North America how much this is the most used non-conventional treatment in cancer, and it's actually licensed as a drug in I think about 21 countries through Europe and also through Asia. All right, so what are some added therapies? I think a lot of individuals want to know, well, what can I do to improve my odds to help me beat this, be more successful in my journey? Here are the list of things I'm going to do a quick review. By no means is this exhausted. I'm sure hopefully if you're interested, I'm sure you might have questions of other things that you've heard. I frequently am taking questions from patients about the latest food product or herb that they had heard of from a friend who was looking at, trying to help them out. But I think some key ones, the first one is hyperthermia. And we'll talk about various forms of that. things like modified citrus pectin, melatonin, fermented wheat germ, pomegranate, genistein, and curcumin. These are probably the most important therapies that would be part of an additive program that could be added, for example, to an active surveillance program for people looking at trying to minimize the risk for biochemical recurrence or essentially rising in PSA. So hyperthermia is very interesting. It's extensively used through Europe. It's not as much used here in North America, different technologies. And external hyperthermia or local regional hyperthermia, which is what's predominantly available in Canada, is shown good combination, particularly with radiation for prostate cancer. There are other forms of hyperthermia. One you may have heard of is HIFU. Tulsa is another one of ablative. It's a higher temperature using a different technology. But there's also transurethral hyperthermia, different than the Tulsa that has been done in Europe for many, many years. There are specific reasons where this can be, or situations where this can be effective. The local regional, the effectiveness of this external hyperthermia, which is available in Canada, it really depends on where the lesion is in the prostate, because the bones in that area can actually affect how well we can heat tissue. I should probably say, well, what is hyperthermia? Hyperthermia involves heating high hyperthermia temperature tumor tissue. It involves heating tumor tissue, and there are a variety of different technologies to do that, because obviously we want to try and minimize the amount of heat to healthy tissues. We don't want to burn. When we combine it with radiation, for example, it prevents cancer cells from being able to repair after radiation. It improves oxygen to the tissue to enhance that. In the case of systemic therapies, sometimes it can help to concentrate that in there and make the cells more susceptible to those systemic therapies. So it can be used in a variety of situations. More often, though, it's within a local, either initial or a local recurrent setting. Modified citrus pectin is another great therapy. Who knew that citrus, oranges, lemons, limes could be so good? Essentially, it's something that's made from the pith and peel of the different citrus fruits, and they're changed using pH modification and heating to create these unique pectins. And there's some really interesting research that shows that it can reduce PSA doubling time when used in combination with radiation. It can make it more sensitive, more effective. So this is a really interesting one. And side effect wise, beyond it being a powder that you have to put into solution, it's actually easy to use. Melatonin. I think everybody has probably heard about this. Often it's thought of as a sleep aid, because it's a very important hormone produced by in our brain by the pineal gland. And it plays a really important role in regulating our normal daily circadian rhythm in our sleep-wake cycle. People who are shift workers can have real challenges because of how shift work affects melatonin. And in fact, we actually know that people who do shift work are at higher risks for a variety of different cancers. Most of the research done on this is with nurses, but there have been other ones done with police and firefighters as well. So melatonin has a very important role because it affects how our cells divide. It also affects our immune function. There's a lot of good clinical trials looking at melatonin in combination with radiotherapy and other protocols, hormonal therapy protocols, to improve outcomes, lead to durable remissions. Fermented wheat germ extract is another one, again, showing this is a component from wheat germ that actually leads to direct anti-cancer effects. And there's been a couple of studies in prostate cancer in combination with radiation. Pomegranate, another one. It's not just a great fruit for your salad. It's also a really important fruit with a lot of different antioxidants and polyphenols. One of the most important ones is something called ellagic acid. And there have been 2 clinical studies looking at pomegranate in combination, actually mainly in active surveillance phase, and looking at reduction in PSA increase time for patients. And finally, genistein, which is a isoflavone found in soybeans, and soy has gotten a really bad rap. A lot of times soy has been misrepresented from a research perspective. A lot of people are afraid of eating soy, men in particular. While it is known as having phytoestrogenic properties, it actually really doesn't. I shouldn't say that, it does, but it's not like you're going to get symptoms of overestrogen if you eat soy. It actually has impressive anti-cancer effects against a host of different cancer cell lines, including prostate cancer. And in fact, when we look at the dietary studies of those people who have higher intakes of soy, we see lower risks associated with prostate cancer, along with colorectal cancer and women breast cancer and so on. Actually, many, many, many cancers. And there are many different isoflavones in it. There are a few small studies looking at genistein in moderate doses, certainly more than you get in food, that can lead to reductions in PSA levels in men with prostate cancer. And so I think this is last but not least, is curcumin. And curcumin, many of you will know by the name turmeric, which is a root. It's often used in different Asian cooking, culinary, but also a lot of different remedies. It's an old but very important herb. And it is probably one of the most widely studied herbs in integrative medicine. It can be useful for arthritis. It can be useful for cognitive decline, but it also has strong anti-inflammatory properties. And actually, there have been 2 clinical trials looking at using infused curcumin, so intravenous curcumin, actually in prostate cancer, and showing some really interesting added effects in different men. Certainly, there are a lot of dietary supplements out there. One of the biggest problems when you use curcumin is it is poorly absorbed. So you'll see lots of different products on the market, and what makes them unique is how they become, I call them fancy curcumins, how well they can be absorbed in the system, so they can act throughout the body, just not just in the gastrointestinal tract. Okay. Now, what are the potentials for recovery, restorative care? Let's say you've gone through a variety of treatments, maybe it's surgery, maybe it's radiation. What can integrative medicine do to help? So urinary dysfunction is probably one of the more common causes of problems or challenges post-active treatment in men with prostate cancer. And it can be caused by surgery, radiation, neurological damage as a result of either one of those 2 things. And there are a host of supportive therapies. For inflammation, we have there's curcumin again, boswellia. We have things that can help break down scar tissue, like certain enzymes, nattokinase, which is actually from soy, serrapeptidase, which is another naturally occurring enzyme. For neural damage, which can happen with either radiation or surgery, although there are now nerve-sparing surgeries that can help with this, acupuncture has a great history of support for urinary tract symptoms, as well as antioxidants like lipoic acid and PEA. Urinary tract symptoms, just directly in terms of spasticity in the urinary tract and inflammation in the urinary tract, things that are traditionally used for benign prostate, like saw palmetto or cytosterols, can also play a role in patients with prostate cancer post-surgery with urinary tract issues. They do work well just at supporting and the healthy urinary tract. And finally, pelvic floor exercises can actually be very useful. A lot of times as a man, we don't realize that pelvic floor exercises are important to us too, and they can help with urinary symptoms in a lot of men quite substantially. Erectile dysfunction is another one. One of the biggest challenges I would say with natural therapies is there are a lot of herbs that can be used and can be helpful with erectile dysfunction. But we have to be very careful because many of them have a concerning effect of elevating testosterone, which can be a strategy that we don't want to employ for most men post-active treatment. One thing that's very important is sexual health is important. It's important to talk about it. There are a lot of supports. Most patients that I see don't actually have a fulsome discussion with their oncologist about this, or their family doctor for that matter. 2 things that I've shown some good evidence for use are acupuncture, as well as an amino acid called arginine. Hot flashes. Again, a lot of people don't realize that hot flashes can be an issue, particularly in men who are on anti-hormonal therapies. And in fact, it can affect anywhere between 40 to 70%, depending on the study you look at. I will say in my practice, a good half of men experience hot flashes. Now, this can be quite minor, and annoying, but not really a problem. And in those cases, there's probably a little benefit for us to chase this symptom. But for some people, it can be actually quite disturbing. It can come on at the least opportune times. It can interrupt sleep. And so while there isn't a lot of research clinically, using actually similar things that can help hot flashes in women can be very effective in men. So acupuncture, different points, but acupuncture can be very useful. Vitex or chasteberry is a herb, black cohosh, melatonin again. These are all things that can be helpful at minimizing some of the symptoms of hot flashes. And what you can start to see here is there's some recurring themes like acupuncture. Well, melatonin's there, curcumin's been in a few points. So part of what we want to do is be strategic, and oftentimes we can choose things that will help both in terms of cancer recurrence prevention as well as help with some symptoms, so that you're not taking everything but the kitchen sink as an approach. Because some patients will come into me with their suitcases of supplements, and one of my goals is actually trying to trim things down so that you don't rattle when you walk. Osteoporosis can also be a concern, and not just if you're on anti-androgen therapy. It's a concern for some of us as we get older in general, particularly if there hasn't been a long history of physical activity. One of the best things to do, and I recommend this for every man, especially if you're on an androgen deprivation treatment, is to actually do a baseline assessment for bone density. A lot of times that's missed. And it's not checked until 2 or 3 years afterwards, or there might have been a fracture to evaluate. So it's important to do a baseline, and that will determine how aggressive of a bone supportive regimen you need. There are some basic things, vitamin D, which also plays an important role in overall health. Vitamin D is actually not a vitamin, it's more of a hormone. And it plays a role in bone health, but also immune health. And there are quite a few studies that actually look at vitamin D and prostate cancer, both risk as well as survival, and find that it's positively associated with survival. There's another very important vitamin called vitamin K2, which what its job is take calcium floating around in your bloodstream and put it into your bone. And it can do this very effectively. Physical activity, again, especially resistance training, is critical. And really those first three, vitamin D, vitamin K2, as well as physical activity, are probably the three most important things to support bone health. Calcium is also important, but one of the problems is sometimes we try to throw a ton of calcium at people, and that calcium begins to deposit in places we don't want it to, like our blood vessels and our organs, some of our joints. And K2, vitamin K2 can help prevent that, but we don't want to overdo the calcium. Another important thing to look at when we're looking at bone and connective tissue health is acid-base balance. A lot of times a lot of us don't realize that we make acids as part of our metabolism. And depending on our lifestyle, if we eat a lot of meat, we don't exercise as well as we should, we're under a lot of stress, we can make too much acid that our body can manage, and it deposits in our tissues, in our joints, and even getting towards our bones. And our bones will actually, when we lose testosterone in particular, as we get older, or if we're on androgen depriving therapies, it will lose the effect of testosterone to hold the bone, and then the bone will start to pull minerals out to buffer the surrounding connective tissue. So this concept of acid-base balance is also critical for bone health. Another very important, and again, until recently underappreciated side effects, particularly of conventional anti-androgen care, is cognitive function. We know that, as in general in men, that as we get older and as there's testosterone reductions over time, this actually affects neurological function both within the brain and the central nervous system and spine, which is part of that. And so there are some studies where they've actually used testosterone. Obviously, that's not a strategy we want to use during prostate cancer. There are also several studies that have shown that anti-hormonal therapies can also affect cognitive function, particularly the longer an individual is on these therapies, the more potential, or the larger the cognitive effects. There are actually excellent integrative treatments that can improve cognitive function. Not a lot specifically looking at individuals going through prostate cancer treatment using certain anti-hormonal strategies, but in men as we age, one, physical activity, again, an underappreciated. I mean, I guess if you take nothing from my talk, being active is critically important no matter what you do. but it actually enhances blood flow to the brain. It prevents reductions in our gray matter, really important. There are also mushrooms. Lion's mane is a really important mushroom that also has neuroprotective, even neuroregenerative effects. There's special antioxidants. One's called PQQ, which is kind of a cousin to coenzyme Q10 that act again to protect the brain and neurological health. Lipoic acid as well as ginkgo also help both to protect the nerve in our brain and in our central nervous system through the spine, as well as improve blood flow there, which is really important. So, I mean, there are some great things that we can look at. Now, again, is everybody taking all of these things? No. But if you're on an androgen deprivation therapy and we're starting to maybe notice a shift in cognition, it might be worthwhile to assess and determine whether these might be appropriate. Now, what about secondary prevention? So again, you've gone through great active treatment. You've been declared all clear, got everything. You know, obviously there's always this worry and there's a stress of, well, what if it comes back? And again, with a lot of these great treatments, the success is very high, but in some cases there are higher risks associated with certain clinical situations than others. And really what we want to do is we want to strategize or take a tiered approach to prevention. And a lot of the therapies I talked about earlier in terms of that have been shown to have activity as an anti-cancer agent in prostate cancer, they become a part of this risk reduction strategy. And depending on the seriousness of the risk, we might use more therapies versus less. But we want to also use those therapies, as I was saying, strategically, those ones that have both symptom support as well as anti-cancer benefits. We also want to look at your history. What environmental exposures, what lifestyle factors may have played a role, and how can we maybe help mitigate those through different therapeutic strategies? So really, we want to do a risk assessment. We want to do tailored chemoprevention, again, with a lot of the agents we talked about, whether it was curcumin or melatonin or fermented wheat germ extract, et cetera. We want to talk about a prescription for lifestyle. So how many days of physical activity to start with? How many hours each day? What diet exactly do you want to be having? You looking at your specific metabolic situation, and then looking historically and saying, oh gosh, you were a firefighter for 20 years. Well, we need to do a few different things with you, okay? Because you've had some exposures, or you were a farmer working with certain chemicals, and so on. There are certain occupational exposures we look at too. It's that concept of looking at the whole picture, the whole individual. All right, I maybe raced through a little bit. I hope it wasn't overwhelming in terms of the content. My goal was actually not to throw things out willy-nilly, but just give you a sense of how integrative therapy approaches can help you in a non-exhaustive way, but help you at different points throughout the care pathway, throughout your healing journey. Anyways, thanks again.
Thanks, Dr. Marsden. That was very informative. And I'm sure we've all gleaned a lot from that. Guys, I don't see any questions in the chat box. So can you please put your questions? I'm sure you've got a lot of questions about some of these, supplements, etc., that you're taking and whether they're appropriate for you or not. Dr. Marsden may not be able to answer questions that are very specific to your personal situation because he doesn't know your history and all that information. But you could ask questions that are more general in nature. Doctor, in the meanwhile, any other thoughts you would like to add? I know you've covered a lot in your slides. And okay, there's one question. What do you feel about sugar and cancer?
It's a very good question. This concept of sugar and its role in cancer was originally highlighted by Warburg. It's also called the Warburg effect. It's actually part of what's used in a PET scan where they inject radioactive sugar and where cancer cells suck it up, because sugar, most cancer cells, not all, but most cancer cells prefer sugar as their main energy source. And the way they metabolize it is important. It's different than healthy cells. as a result, we've kind of looked at sugar as being the main culprit. And I'm not saying, have a high sugar diet. That's not a suggestion, but I actually think one of the real problems is insulin and insulin-like growth factor. Either way, it's the same. Dietarily, we want to minimize simple carbohydrates, not just sugars. So it's not just about, your usual cookies, donuts, etc., but even our pastas, our breads. For many of us, they represent 70 to 80% of what we eat. So we do want to minimize those. Completely eliminating sugars is often not an effective strategy for certain individuals, especially if there's no problem with insulin. So this is where part of the testing comes in. Do you have early signs of insulin resistance? Are your insulin levels high? Do you have high levels of something called insulin-like growth factor? This is something we can see in the blood for individuals. In those patients, those individuals, we can look at strategies to minimize sugar through diet, through medication, through supplement. And so, I'm not always a huge fan of just using a ketogenic diet, but certainly as part of all diets, we want to look at simple carbohydrate restrictions. It's important.
Thanks. The next question is, you mentioned a caution with American ginseng. Is Korean red ginseng the same?
Yes. So both Korean red and American, actually Korean red more than American. I should have mentioned that more clearly. There is a greater potential for elevating testosterone with that. And there are so many other good choices that we can use of other herbs that don't do that. So this is where things come in, like ashwagandha, kind of Indian ginseng, or astragalus. There are a variety of other adaptogens or other herbs that can support fatigue, energy, cognition, etc. That we would choose well ahead of the traditional American Panax ginseng, which is Korean red, or Panax quinquefolium, which is American ginseng.
Next question is, how can we ensure the purity of supplements? The questioner has heard that some can contain trace toxins depending on the source.
That's a great question. In Canada, we're lucky. It depends on who you ask. But in Canada, we're lucky because we actually have a health product industry that's regulated. So Health Canada, now it's not tightly regulated in terms of, not like prescription drug industry. Granted, the money involved in it is, big, relatively speaking, it's very low. But they require things like lot batch testing for licensed natural health products in Canada. In other jurisdictions like the United States, it's more of an open market. There's really no requirement for testing as of yet, although that will likely be changing over the next 4 to 5 years. So it's important to understand the vendors, the different suppliers. I know for us, we're very particular. We actually, in our clinical practice, I will ask all of our suppliers once a year. I will take a product off of the shelf and I will look at the lot batch and I will ask them to send us the certificates of analysis, lab analysis, to confirm that they've done things to look for the presence of toxins, of microorganism, of mold, and also things to make sure that what they say is in the label or is in the product on the label is actually there. And so this is one of the reasons why working with a professional is a good idea. They should know brands that are more prone to it. But as I said, in Canada, over the last 10 years, the landscape has changed. There's more quality. The quality is ubiquitous. I will say you have to be very careful with products from Asia. There are numerous case reports of patients taking patent products brought in from Asia that often contain drugs, hormones, or other things. So that's not saying all of them. In fact, most of our raw material for supplements come from Asia. So there's a lot of great quality stuff coming from there, but you want to make sure that it's being tested and checked with a reputable manufacturer or importer.
Next question is, should one wait after radiation and androgen deprivation therapy before taking herbs and vitamins? And how long should one wait?
Yeah, that's a very good question. I think with this, it depends a bit on the context. Sometimes we'll wait a few months for at least one, maybe two PSA measurements to get a sense of, are we dealing with any residual disease? That often can be we don't want to start treating with things that can reduce PSA if we're looking to see, okay, you've had radiation or surgery. We're looking what's happening here. Well, you have a surgery, has your PSA zeroed out, what's happening there. But yeah, you can actually look at, up to a week, really, once radiation is done, within a week or so, that's often when side effects will peak, about a week after radiation. We'll want to see that come down, and you can begin 1 to 2 weeks afterwards. There's very minimal interaction within a short period of time with radiation.
Next question is, if it's been a long time since my surgery, can these things still help?
I would say, actually, you guys are asking great questions. The answer is, I don't know. And I don't mean to be flippant or silly. It really does depend. So for example, if the problem is, let's say it's a urinary tract issue, and I don't know. So I'm just putting one out there. If there's significant scar tissue, if there's a lot of neurological damage and it's been years and years since then, it will be more challenging. Not impossible, but more challenging. So the answer is, a lot of the time, it depends on how significant the issue is, what the issue is, how long it has been. But usually I'll tell patients, you know what, listen, we can try a couple of months of treatment. If it's usually by that time, we'll have a sense, is this helping? And if it isn't, okay, maybe we'll try another, but we won't try, we won't treat futilely, basically. Usually we can see results in a fairly short period of time for most of the things, whether it's urinary function or fatigue or, but a lot of these things like osteoporosis, for example, yeah, it can be years and years after these things. Again, that's not surgically related.
Next question is, what do you recommend regarding alcohol consumption and dairy consumption?
So with alcohol consumption, I have the 2-4 rule. This is how I'm a very successful doc, and people keep coming back to me. No, the 2-4 rule is, first, I preface this rule with, there is no healthy level of alcohol consumption. So I know that ages ago, we thought, oh gosh, drinking red wine, it has these great antioxidants. One of them is called resveratrol. That's the French paradox. They drink the wine, they stay healthier. That wine's got to be good for them, even though there's a lot of alcohol. The answer is as we've broken that down further, the antioxidants in that wine are so small that you'd have to be pickled before you drank enough wine in order to have an effect. Likely, how wine has an effect is by relaxing people, and there are better options than alcohol for relaxation. And we know, actually, as time goes on, the suggested number of drinks that are safe for an individual are going down and down and down. Based on the most conservative estimates of research, the 2-4 rule that I talk about is the best way to look at alcohol consumption, meaning no more than 2 in one, so 2 servings of alcohol. So that's 4 to 6 ounces of wine, a pint of beer, an ounce of hard liquor, no more than 2 at one time, and no more than 4 servings in a week. And there isn't a study at this point in time that shows anything less than that, that or less could increase the risk of developing cancer. I don't think you need to avoid it completely, but less is more, definitely. Dairy consumption is interesting. I think that less dairy is, again, it's one of those animal proteins, the type of fats in it can be problematic. It can modify the microbiome. So less is more around dairy. Certain individuals may have a gastrointestinal function, a digestive function. They may have some changes if they went through radiation that can make them more sensitive. And we recommend complete avoidance of dairy, but certainly we recommend reducing dairy as little as possible.
Next question is, you've mentioned melatonin a lot. Is there too much melatonin?
Like everything, yeah. I mean, anybody who says, no, you can take as much melatonin as you want, no problem. That's not correct. We're very careful with younger individuals taking melatonin, because taking melatonin can actually lead to suppression of your body's production of melatonin. There are some studies to show that. Now, as we get older, if we have been doing shift work, there are a host of factors, but basically our melatonin production goes down over time. So really, we're not afraid of that as we get older. Most people's melatonin levels decline, especially when you live in the city, because most of us are exposed to way too much light in the city. And you can think about it when you go to bed tonight, hopefully not during this talk, but when you go to bed tonight, you're going to see light coming in from the street lights beside you, light from your phone or from your clock radio or in the hallway. We all have way too much light exposure, and that light inhibits melatonin. And there are studies that the more light that we're exposed to at night can affect our risks of certain chronic disease, including cancer. So we're less concerned about too much melatonin as we get older, but there still is a concern. There are some people who just can't take melatonin. Some people who will take 1 milligram of melatonin and feel headachy, have their sleep actually be disturbed. So it doesn't help their sleep, but makes it worse. So yeah, I mean, the ranges are from 3 milligrams into cancer-based clinical trials up to 20 milligrams at night. That's generally the range, but there's a lot of variability within that based on time.
The next questioner says, excellent presentation. Could you review your discussion on erectile dysfunction again? And if someone has had surgery and the subsequent PSA is low, can the cancer come back? And what would be the top 3 strategies to prevent it?
Okay. Thanks again for a great question. And thanks for the thank you. So the erectile dysfunction, there are a variety of herbs that can use. So my first was a warning. I guess that's what when I talked about it. There are a variety of herbs that can be used. One that I've seen some men go to, we talked about ginseng, we've talked about all sorts of things. We want to be careful with some of these. There's one called foti. There's actually one called horny goatweed. All of those, many of those have the potential. Some of them have the potential for increasing androgens, and depending on your situation, that may be that'd be often likely not something we want to do. There are things like acupuncture in a skilled provider can make a meaningful difference. And don't worry, the needles don't go where you think. The needles are peripheral usually. Although there are some in the abdomen and pelvic area that can be there, but and arginine can also be, especially if it's scar tissue blood supply, nerve supply. So sometimes, depending on the procedure, we can sometimes use high doses of neural supportive antioxidants. With erectile dysfunction, we sometimes have to be pragmatic depending on the type of procedure that was done, the location, and how successful, especially if nerve sparing surgeries weren't done, that can be a challenge. But really the key ones would be arginine, neuroprotectants like alpha lipoic acid, like phosphatidylcholine is another one, and acupuncture. Those are kind of the mainstays. And then if you've had surgery and the subsequent PSA is low, can the cancer? So I'm wondering, can the cancer come back? Is it with a question mark? I'm not sure who wrote that. Is that?
Yeah, and what would be the top 3 strategies to prevent it if it came back?
Yeah, I mean, I don't want to be. I mean, I'm generally quite a positive individual, but I mean, I would be stupid if I could say, no, the cancer can't come back if your PSA was low. Kick me off the presentation right now if I did that. But certainly, with surgery, depending on the type of surgery, but generally we want to see the PSA being zeroed out. If we see some residual PSA, that's generally not a great sign, but anytime PSA things. Oh, sorry, I thought I heard somebody. So basically the top 3 preventive strategies. So we'll go with physical activity, diet as 2 very important strategies because really they have some of the most compelling research on them. But I would then sort of debate with certain chemopreventive strategies, whether we use things like modified citrospectin, whether we used things like genistein, so one of those various. And again, we look at, well, do you have arthritis history? Well, maybe we'll use curcumin too, because that might also help with your arthritis. So I would pick between a couple of those top 6. Pomegranate would be another big one. I don't recommend the juice. Certainly the juice would work, but there's a ton of sugar in the juice. And so to have enough juice to have the clinical effect, you're getting way too much sugar. So usually we use a supplement for that.
So the next question is, intravenous therapy was mentioned in the introduction, like IV vitamin C therapy. How effective is that for prostate cancer treatment, and is there good research?
It's a good question. One of the things that people think of when they think of naturopathic cancer care is vitamin C IV. And certainly it's something we do a lot of. With prostate cancer, in most situations, vitamin C is probably not that effective. If an individual is undergoing chemotherapy, there may be some benefit, but for the average individual going through prostate cancer, there's not a huge benefit. And there have been 2 clinical trials that have looked at this, one published even last year. So high dose vitamin C for prostate cancer is not one of my big choices. If we're going to use anything very aggressive because we're concerned about maybe advanced disease or extremely high level of risk, we may look at using mistletoe in an intravenous form. But we want to try and stay as non-invasive at all possible. There are other IV therapies that are coming along in the natural space. I talked about curcumin. There are 2 clinical trials that have now been done with IV curcumin in prostate cancer. They've all been done in individuals with advanced disease, and some interesting, results with anywhere between 30 and 50% response rates in individuals who have actually kind of failed all different treatments. So IV therapy is not my first line for most patients. And honestly, one of the challenges the question of, is there good research? It's probably one of the more important questions, because I believe deeply in research. There's a lot of research we have. When I talk to some of my conventional colleagues, there's a lot of criticism of some of that research, because a lot of the research we have is small numbers, not hundreds or thousands of people, but maybe 40 to 100 to maybe 200. It does depend. For some of the studies like vitamin E, there can be tens of thousands. So there are some studies that are bigger, but in general with natural non-conventional therapies, it's smaller. And part of that is just money. Not that there isn't value in it, but most of these natural therapies you can't patent. There's no business case for it. So everything has to come from grants. So there's a limited pool of dollars to fuel these, but we do have a growing body of evidence on this.
Is there a difference between vitamin D in pill form compared to liquid form? And is there any specific vitamin D you would recommend, and where to get it rather than buying from a regular pharmacy?
Yeah, most vitamin Ds that are available in Canada are vitamin D3. And so as a molecule, D3 is D3 is D3. But where the difference comes in is what the D3 is in. So one, you want to see the vitamin D3 in like a gel cap in some sort of fatty liquid. And that's because vitamin D is a lipid soluble vitamin. It requires fat in order to be absorbed. The other issue is some people, and many of us, as we get older, we don't digest and absorb our fat. Also, some people have changes in their microbiome in the gut, the different critters there, that makes it more difficult for them to absorb fats. So there are certain formulas of vitamin D that are fancier, that are emulsified, that make it easier to absorb. In general, if it's a good quality gel cap, I mean, even more of the retail brands like Swiss and Sisu and Natural Factors, and now they have good vitamins. I have no affiliation with any of these companies, let me be clear. I would say if you get in a tablet or a powdered cap or something like that, definitely no go. The fancier forms are emulsified. So if you look for emulsified vitamin D, especially if you don't have a gallbladder, for example, you had that removed, it'll be more difficult for you to absorb. There are certain people that also have genetic polymorphisms in their vitamin D receptor. Not to get too fancy there, but there's certain people that don't absorb vitamin D well, and they need it either very higher doses or also in that emulsified form.
Next questioner says, you didn't mention cranberry juice. What situations warrant its use? How does it actually work? And he appreciates your presentation.
Thank you again. I'm getting my green tea in. The cranberry juice, from a prostate cancer support perspective, cranberry juice doesn't have a huge volume of evidence. It has a good urinary tract support. It can be helpful for prevention for some urinary tract infection. It's a great berry. It has wonderful antioxidants. But if I were to pick sort of antioxidant rich berries, I would pick either pomegranate or raspberry, actually, which have higher levels of ellagic acid, which is one of the more important polyphenols from a cancer perspective. If we're looking at cranberry from a urinary tract infection, which can be important, like, especially depending on the type of treatment that may have, and if there's maybe a catheter in place, the cranberry works to prevent the little hands that are on bacteria in the urinary tract from binding and holding on to the urinary tract. So it helps us flush those through. So it's a great preventive from a urinary tract infection. I hope that answered it. I'm not sure.
Next questioner says, wonderful presentation. Wondering if you could please give the name again of the antioxidant supplement that is related to CoQ10 and your experience with it.
Sure. The antioxidant acronym is called PQQ. It's pyroquinolone, pyroquinoline quinolone, I believe. PQQ. We'll go with PQQ. And it actually has it's specifically central nervous system. And for a lot of people with cognitive impairment, not just long-term androgen deprivation therapy, people on that, but whether there's sometimes vascular dementia. So as we get older, sometimes the little blood vessels going to our brain can become clogged, can become less effective at blood flow, and that can lead to atrophy of the brain and so on. It can be helpful there. There are some studies in Alzheimer's disease as well. So it's a good total cognitive support, but PQQ. It's one of my foundational therapies for people with cognitive challenges.
Next question is, do you support a complete plant-based diet? And are you finding that more conventional oncologists are taking integrative care seriously, or do most still dismiss it?
So we'll go with the plant-based diet first. I do support it. I support it done properly. One of the things that I see sometimes is people who are on a plant-based diet can sometimes be a starchitarian rather than a vegetarian, because often if you haven't grown up vegetarian or you haven't been doing it a long time, it's hard to pick and hard to make sure you're including all of the protein sources. So, one of the things we talk about is, okay, if we're going to go to a vegetarian diet, let's make sure you're getting adequate proteins, make sure you're getting your legumes, make sure you're getting your nuts and seeds, make sure you're getting your grains in there, trying to make sure we're not going into too many simple starches, and making sure we're not running deficiencies, particularly B12, vitamin D, iron. Those are common, although iron is less important in men as we get older. But yeah, I do support a plant-based diet. I do think you can get the benefits from a diet that's high in plant without being completely vegetarian. So there's good data to say that low animal protein intake, particularly things like fish and so on, can be as effective as being completely vegetarian. And there are some people who can't be vegetarian, that just from a health perspective, for various reasons, metabolically, nutrient absorption, etc., can't do it. So this is where we want to individualize it. The question is, are you finding that more conventional oncologists are taking integrative care seriously, or do most still dismiss it? Ontario is a unique beast. I've had the real great blessing to have traveled the world. I've been throughout the States, South America, Europe, not Asia. I was going to lecture in Taiwan a couple of years ago, but something came up, if you don't know. But basically, here we tend to be more conservative. In Ontario in particular, maybe even in all places in Canada, BC is a little bit more open. And so there is more openness than when I started 20 years ago, no question. There are more questions being asked, which is great, but we're still in an area where there's more concern about safety and less openness to looking at the potential efficacy of non-conventional treatments. But I'm hoping over time it'll continue to improve.
Okay, the next question is there a supplement to get vitamin K2?
Absolutely. There are two main forms of vitamin K2. One is called MK4. You usually need a much higher dose of that one. The other one's called MK7. Both are available over the counter. For the MK4, we usually have to write a prescription to have a high enough amount. Absolutely. Absolutely. You'll see it on most shelves, vitamin K2. Yeah. Lots of places have it. It's in most bone building formulas.
Okay. The next question actually is a direct question to me, so the others may not see it. He wants to know your views on cannabis.
Oh, cannabis. I tell people I'm very green with cannabis. I've never used it, but we recommend it often. So as an anti-cancer therapy, it's controversial. And we can't say. I have seen clear clinical cases, mainly systemic malignancies like leukemia, lymphoma, and so on, where there seem to have been some benefit, and there is research. Certain cancer cells have certain cannabinoid receptors on them that seem to be affected in one way or another by cannabis. Cannabis can be helpful for some side effects, whether it's sleep disturbances, depression, anxiety, appetite problems, neuropathy, neuralgias, sometimes with radiation. Occasionally, I've seen some patients with neuritis afterwards. It's rare, extremely rare, and it can be helpful in that cases. But there are side effects of cannabis, depending on how much is used, the type that's being used, and so on. So it has its use, but it's not one of my first go-tos.
Okay, next question is, in brachytherapy, radiation free radicals attack cancer cells. Would the use of antioxidants nullify the effect of brachytherapy?
The answer is strong antioxidants. So dietary stuff, like you have a bowl of blueberries, probably not. But when we're using certain high doses of clinical supplementation, I think there is a significant risk of it. The reality of it is we don't have a lot of data on the combination. So how I approach it with patients is, if I don't have a clinical trial in the combined use of a natural substance, particularly one where there's controversy, where it might be an antioxidant, alongside something like radiation therapy, whether it's brachy, external beam, proton, whatever, then we want to err on the side of caution, because if you're going to walk through fire to do this treatment, I sure as hell want to make sure I don't do something to screw it up. So yeah, we need to be cautious.
Next question is, what is your opinion regarding amygdalin, apricot seeds?
Okay, so B17 or amygdalin was very, very popular back starting in the 70s. There is some data that it has some anti-cancer effects. My experience is the oral can be dangerous, actually, because you need to use, in theory, a lot. And it actually is less safe orally. There are people who go down south to Mexico. There are some European clinics that administer this. I'm not very hot on it. I haven't seen it do a lot of great things for patients. So, and it can cause an acidosis. So we have to be careful with it. If you took one apricot seed, 2 apricot seed, is it going to cause you a problem? Absolutely not. But that also probably wouldn't help you. I don't think it's necessarily worth it.
Next question asks whether you will share your presentation.
I'd be happy to. So I'm happy to share a PDF of it. I can send that to you guys for sure.
Great. Next question is, how should we deal with organic and non-organic saga when choosing our food? What are your thoughts on this issue?
Yeah, these are great questions. Thanks so much. Actually, I really enjoy this. So thanks for being really thoughtful and asking these things. So there are 2 issues when we're talking about organic versus non-organic foods. The first is with organic foods, are they more nutrient dense? We actually know that the nutrient content of our food has declined over the years. And it does have to do with how we treat our soil and modern commercial agriculture. It's depletes it. So we actually know they've had to adjust the nutritional tables over the last 3 or 4 decades because the nutrient content food has declined. The second question is, well, what's the level of toxicity of pesticide residue in food? And is that a problem? I'll address the first one. It's not clear the nutrient density, whether or not it is more dense in non-organic versus organic. And why I say that is there are some studies that show it is, and some studies that show that there is no nutrient difference, quantity difference. I think a lot of it has to depends on how it's organically farmed. So there are different forms of organic farming. There are different ways of preserving soil and enriching soil. Actually, I think one of the best ways to look at this is if anybody gets a chance, go on to Netflix, look at The Biggest Little Farm, or actually, I think it's Disney now. Anyways, again, no affiliation with these, but there's a great a documentary called The Biggest Little Farm, and it talks about taking this barren patch of land in California and really using organic principles or holistic biodynamic principles of farming, of multiple products, integrating livestock along with other plants based like fruit trees, etc. And it really does a good job. And that's going to be a really nutrient dense product, that for sure, because we're dealing with quality soil. Now, if we just take a same barren plot of land, use organic fertilizer and use organic pesticide, because there are different forms that are considered organic to be getting the label, is that going to improve their quality? Not much. So I say focus on local organic if you with growers you know, if you can. The definite thing we know is organic produce has lower pesticide residue. Now, for certain foods, it doesn't make a difference, like mangoes or pineapples. A lot of those kind of tropical fruits. But for fruits like apples, peaches, pears, nectarines, certain imported grapes, even kale, like who would know? These things are known to have high levels of pesticide residue. Now, the argument will be, well, there's so little in there, it's not going to cause a problem. But we know that all of these little things, many of them or many of their metabolites accumulate in us. So we're not talking about one thing, but if there are 100 things we're exposed to, like the flame retardants in our new clothes that we bought, like the formaldehyde that's in our tables that we bought, like the volatile compounds in the paint in our house, the sealants, plus the food we eat, plus it's the combination of the soups that we live in. So whatever you can do to minimize is great. And the Environmental Working Group, which is a nonprofit in the States, every year they do the Dirty Dozen, the Clean 15. It's a list of those vegetables and fruits that have the highest pesticide residue. And then the other thing you have to be mindful of is actually fish that you eat. So you want to try and stay away from those big fish, ocean-going fish, smaller fish like herring and mackerel and so on.
Excuse the interjection, Keith, but there's a question that came to me rather than to everyone, and it fits in right at this point. And the question is, let me read it. What foods are good to improve a low hemoglobin?
It depends on the cause of the low hemoglobin. So if it's a nutrient deficiency like iron, the foods that we want to eat are, there's certain vegetables like spinach, but actually usually meat is the better source, particularly organ meat like liver, organic liver in particular. For any of you who are Italian, horse meat, apparently. I don't recommend it. I'm just saying those are the things that build it. If it's B12, there are, again, certain animal products that tend to be higher in that. Folic acid is another one. So we want to look, are there specific nutrients driving it? And then if not certain nutrients, what else? There are other things that could be going on like bone marrow suppression. But usually if it's a deficiency, it's those kinds of foods. There are some vegetarian sources of iron and B12, but they usually don't have a lot. So if you're a vegetarian, what we recommend is usually a vegetarian-based food supplement. So there are some great ones out there.
Thank you.
Or iron supplement.
Next question is hypothermia easily available in Canada, and have you seen success with that for prostate cancer, and under what circumstances?
Okay, great question. It is available in Canada. Full disclosure, I'm biased. It is offered at our clinic. It is the type of hyperthermia that is offered at this point in terms of, so they're depending on how you define hyperthermia. I mean, HIFU is a type of hyperthermia. It's an ablative type, and that's offered, I think, at the Cleveland Clinic in Toronto area here, or through the Cleveland Clinic. The one that we do is an external local regional hyperthermia, and it can be effective when used in conjunction with other conventional treatments. So for example, where we're trying to amplify radiation effect for treatment of local prostate cancer, or maybe nodal metastasis of prostate cancer, local pelvis, and so on. It can be effective if, for example, there's advanced cancer and there's radiation being done for bone. It can be helpful in those circumstances. So it is more of a local treatment. That would be the cases. Post-surgically, no major benefit, and it's certainly not an alternative therapy. Depending on where the lesion is, so sometimes if it's an apical lesion, sometimes the hyperthermia has a hard time. It can get blocked by the bone. So anatomically, there can be certain features of it that can also affect whether a lesion in the prostate can be treated effectively with hyperthermia.
Next question is, he says, zinc is an important mineral in prostate. Would you recommend zinc to prostate cancer survivors? And
the answer is if it's deficient. So, and we can look at that either through a diet survey or through testing, and there's different ways to test. It's not as important of a mineral as we used to think so, but yes, it is still important. And normally what we'll do is we'll look at your diet, an individual's diet, and say, is it deficient? Because the testing we have, like blood tests, they're semi-accurate. So it's better for us to get a bit of a lay of the land of your diet and see it. And worst case scenario, do a zinc supplement. Sometimes we have to be careful with zinc, because if you over supplement zinc, it can sometimes cause your copper level to become depleted. So sometimes we'll do both zinc and copper. But sometimes we want to deplete your copper, because copper can sometimes cause new blood vessels for cancer to grow. So, yeah.
What supplements would you recommend for cognitive decline in advanced prostate cancer patients?
You know, actually, so interestingly enough, and we're talking about advanced cancer, I would actually say mistletoe, which isn't a supplement, it's actually an injection, or it's an off-label injection in Canada. It has a really profound impact on the neuroendocrine axis, or the nervous system hormonal axis, which I've seen make really profound differences in energy and cognition in patients with advanced cancer. Lion's mane is another really important one, as well as lipoic acid and potentially ginkgo. We have to be mindful of what treatments the individual with advanced cancer is on. You know, are they on abiraterone? Are they on doing radioactive lutetium? These might cause us to maybe not use some of the antioxidants. But that list of things we looked at, lion's mane, lipoic acid, ginkgo, PQQ, and mistletoe, those would be the key ones.
There's a clarification from the gentleman who asked a question on melatonin. He says, I didn't articulate my question fully. The presenter recommended its use for at least 3 purposes. That is just not for sleeplessness alone. So using his 20-gram limit for sleeplessness, should a person then not take more than 20 grams regardless?
Okay. Thank you for circling back on that question. So first off, generally the maximum dose we recommend from a cancer prevention or supportive treatment is 20 milligrams. That's the general maximum dose. Have I seen patients, or have I recommended higher? I have, but the clinical research is around 20 milligrams. For sleep, generally between 3 to 10 milligrams is what you need. If by 3 or 5 milligrams, there's really minimal effects, it probably is not going to help with sleep. So 20 milligrams is usually what we're working with when we're dealing with cancer prevention. 3 to 5 is more for sleep.
Next question is, besides melatonin, what else would you recommend to improve sleep?
Somebody mentioned cannabis. No, that wouldn't be my first recommendation, although it can be effective. But the problem with cannabis and sleep, now that I brought it up, is it can interrupt REM sleep. So sometimes you don't get as deep of a sleep with cannabis. So we have to be a bit careful with that. Other things to help with sleep, there's so many, because actually Sleep is a huge issue. Sleep hygiene, number one. So we talked about no lights in and around the room. Big one. No screens before bed. So don't do this before bed. At least an hour to 2 hours. Calming down, read a book, listen to music, that kind of thing. That's one. Then, of course, there are some herbs, whether it's valerian, passion flower, skullcap, hops, lemon balm. These can be also really quite nice things to help to support sleep. Being physically active during the day also supports sleep. Yeah, those would be the big ones from a sleep perspective. Theanine can also be helpful, which is from green tea, actually. Theanine is another nice one.
When you talk about cannabis, Dr. D, are you just talking about CBD or CBD and THC?
Oh, I'm talking about cannabis as the whole, thing. So there are almost 80 different cannabinoids that they have identified in cannabis. And depending on the strain, so broadly, there's indica strain, which is, think of indica, indicouch, calming, sedating, and sativa strain, which is a more awakening. Their profile of cannabinoids can be different. THC being the main one that's psychoactive, that binds the cannabinoid receptors in the central nervous system. CBD, which is another broad one, it doesn't really bind the cannabinoid receptors, but it does affect their expression and their use. It can have anti-inflammatory effects, some cognitive, some neurodegenerative or neuroprotective effects as well. But there's many other cannabinoids, cannabivarin, cannabinol, and then there are terpenes. So these are the smells. There are terpenes or volatile agents that also have what's called an entourage effect that actually can enhance the effectiveness of our own endogenous cannabinoids as well as the ones that are in the product. And so cannabis is actually a very complex topic that has uniqueness for the prescribing. So yeah, when I'm talking cannabis, I'm giving the broad. CBD, you have to be careful. CBD, there's industrial hemp CBD. That's the one that costs cheap. And then there's the actually hemp, the cannabis, the female plant cannabis based CBD, which usually you need lower doses and you have better clinical effect because there's other things in it.
And what is RSO and how does that fit into this?
Yeah, RSO is Rick Simpson oil, Phoenix tears, sometimes it's called. This is a high THC. You know what? I've seen some men who have used this. I remember I said systemic malignancies, but as soon as you said RSO, I've seen some men where it seems clearly that this helped them with their prostate cancer. Like their PSAs were going up, they started RSO, and it stabilized it or dropped it. I can't say I've seen it consistently enough that I recommend it routinely. And the other problem is because it's a very high THC, you have to be very careful about its use. You have to be very gradual. And some men can never get high, no pun intended, high dosed with it. So actually what some men will do is do it rectally because when you don't do it orally, you don't get that first pass effect. And so tolerance can be better rectally. As I said, I don't think enough people get a great response that's good for everyone. But if there are other benefits, so let's say you're having sleep issues, let's say you're having some anxiety, let's say you're having some pain, then I think there's probably good value in giving it a go.
Okay. Next question is, what essential oils would you recommend for sleep and to heal?
Oh, that's actually well timed. We talked about terpenes, which are basically essential oils. Limonene. So lavender is a great essential oil for sleep, is probably the best one. The most research on it, the best history of it. You also have sometimes frankincense. Boswellia is a frankincense. So those two are common ones, I would say, from a sleep. From healing, Boswellia would be one of the big ones. Patchouli, there's a host. You have to be careful. Some of those essential oils for some people can be very irritating, some of the smells, but if you were to look at two, lavender, frankincense, lavender, frankincense.
Next question is green tea better than black tea?
Depends on, so the answer is they both actually have different effects. From a cancer prevention perspective, our green, oolong, and white teas are better because they have higher polyphenols. These are non-fermented teas. They're non-oxidized teas. And so they have a greater antioxidant. They have more things in it. From a black tea, though, black teas are astringent. So actually, if there's digestive upset, so from a gut perspective, the black tea can be sometimes quite useful. But from a cancer prevention perspective, the green tea has by far the more research. Try to get organic and try to get good quality tea. So you actually don't want tea from a bag. You want whole leaf tea. That's a different quality, basically. Yeah.
And, next question is, in your practice, have you seen patients decrease PSA significantly, for example, like from 10 to 4?
I'm assuming the question is using sort of non-conventional therapies. Absolutely, I have, yes. 10 to 4, I've seen 200 to 100. So yes.
Okay. Next question is, they're wondering if you're able to comment on your experiences with the effects of vaccination, including the new COVID-19 vaccines in patients with active cancerous processes.
I'm trying to get my license suspended. No, I mean, I'm fairly, honestly, if I say anything about vaccines, I'll probably, somebody will show up at my door tomorrow. I'm not anti-vaccine. It's funny, by me saying that, I make it seem like I'm anti-vaccine. I mean, I'm a quack, but I think that they're important. They play a role. We can argue about how important the COVID vaccine is now at this point in the pandemic, but certainly early on, huge things. I've seen different things with the vaccine relative to prostate cancer. I don't feel that I saw anything meaningful impacts for most men who got the vaccine. I have seen in women in particular, and certain autoimmune conditions and systemic malignancies where there may have been an impact, but I can't speak specifically about prostate cancer.
Next question is coffee helpful for cancer prevention or treatment?
That's a good question. And I don't know if we have enough data to make a conclusion on that. We used to think coffee was a bad thing. And then there's some increased data that coffee may actually be helpful. I think a lot of it has to do with the form of the coffee, how much sugar and milk you put in it. If you drink coffee like me, it's not healthy at all. And I don't drink much coffee, it's tea. I think there are better beverages, particularly like tea, that has a much more solid basis for its potential benefit.
Well, Doctor, we are almost at 9. We still have 7 minutes more, and we're at the end of the questions list. Oh, there's one more. Can you tell us examples of patients that you have treated them and they have really recovered by using naturopathic medicines versus conventional treatments and would have not recovered otherwise? What would you say to some conventional doctors who may have a rather neutral opinion or naturopathic approach?
So my first is I never recommend an alternative only approach. Have I treated patients where, because that was their choice, that I respected it for a period of time and we evaluated? Yes. Are there some patients where they did well on an alternative only? Yes, but that's not the rule. That's the exception to the rule. So what I say, I do not recommend a non-conventional strategy only because in general, it is not as effective as an integrated strategy. Have I had people who are kind of finished all of their conventional treatments and done treatment with us and done well? Yes, but I also know that probably there are many more who didn't do well because it was too late. So I think really about an integrative approach. In terms of conventional doctors who have a rather neutral opinion, actually, I love neutral opinions of us. Thank you for being open-minded. Even though, you know what, I love to have dialogue, right? I think often physicians are surprised when they have a conversation with me and I understand conventional stuff, and I'm reasonably conservative in my approach, particularly in certain situations where there's clearly established great conventional treatment with strong evidence base for use. and I don't, and as I mentioned before, like with radiation, I don't want to do anything to screw it up. If you're going to walk through fire and this is very effective, I don't want to screw it up. What I would say to conventional doctors who have a neutral opinion, great, let's talk more. And maybe we can be partners for patients, because we all, I would say same church, different religion. We're all here to get everybody better. I mean, we just want you better. I'm lucky in that I get to know you, like I get to know patients, right? I look at the whole picture. I do try to see all aspects of the patient's life, health, and care, where a lot of physicians don't have that opportunity. So this is where, when we can be partners, it works great. So I don't know, I don't know if that was a politician's answer.
Next question, are pumpkin seeds useful for preventing recurrence?
We don't know. They reduce inflammation, like pumpkin seed, and the different components in pumpkin seed have a definite anti-inflammatory effect on the prostate. And so, whenever possible, yes, that might be helpful. If you no longer have a prostate, I don't see any potential benefit, but they could be another component as part of those urinary tract support therapies.
Well, looks like we're finally out of questions. So thanks a lot, Doctor, and I'll hand you back to John.
Super. Thanks, guys.
Thanks so much, Dr. Marsden. This has been a fantastic presentation. We've learned a huge amount tonight about how integrative treatment options can help improve the treatment response and survival, reduce the side effects of conventional care, help prevent recurrences, and improve quality of life during and after treatment, including sexual health, reducing fatigue, and so on. So we just can't thank you enough for coming tonight and giving us your time and expertise. And as is our custom with our Awareness Night guests, we will be presenting you with an honorarium, Prostate Cancer Support Toronto, that you will be giving to your preferred charity. So thank you so much. And yeah, just a great evening. Thank you.
Thank you, everybody. It was a real pleasure. Thanks so much.